This is California Edition. I'm Brad Pomerance coming to you from Sacramento, the state's capital. We are joined by Dr. Ed Hernandez. He's an optometrist. He's also a member of the California State Senate. And sir, I want to speak with you about the Affordable Care Act. Wow, it's hard to deny that the Affordable Care Act lured in a lot of folks. You know, when you look at the signups, over 8 million, way beyond projections. The CBO had brought projections down to 6 million, then maybe 7, way over 8 million. What happened?
Well, what happened is the consumer realized the value, but more importantly, all of what they can get and what's covered. And there's people all over the country, but more in particular in California, were just clamoring to have health insurance. It just shows you the need for health care reform.
And let's talk about California. I think it's fair to say if you look at the 50 states, the two bright lights, Kentucky, who knows why,
Right.
and California,
Right.
in terms of Affordable Care Act signups. Why do you think California was such a beacon in the Affordable Care Act's rollout?
Well, first of all, because we have a committed legislature, a committed governor, but more importantly, the legislature itself wanted to make it its priority. First, to have an exchange. Governor Brown called a special session last year, which I carried all of the special session
Right.
bills to implement it.
But
California wanted it.
Governor Schwarzenegger, a Republican,
Yes.
had kind of put that into motion.
Yeah, with the exchange.
Right.
Yes.
And so let's talk about now that we're into the Affordable Care Act, people are receiving their insurance. Are they understanding the process? I mean, to be insured is new for a lot of people. This whole notion of, you know, the culture of coverage. I don't know what to do with my coverage. Are you working with your constituents, for example?
Yeah, I mean, we work collaboratively with everybody in the community, whether it's hospital systems, nonprofits, for-profits, you know, all the groups to first find out what was going on, what their concerns are, but more importantly, the consumer needs to be educated on how this new product is. So you're right, you have a lot of people who never had health insurance. Well, for the first time, they're going to be able to get vaccines.
Right.
They're going to get preventative care. They're going to get services they've never been before. They're going to now go see a doctor as opposed to waiting for the emergency room.
And that's part of the key is, it really is a sea change in terms of receiving and the delivery of medical care. Like you said, the standard course was walk into the emergency room.
Right.
You got to really change behavior.
Right. Well, most people in the past, if they had insurance, they'd get a high deductible, low out of pocket, would use it very seldom, or people were priced out of the market, would only go to the doctor if they absolutely had to, and most of the times it was when it was either chronic disease that got too out of control and the costs were very expensive. Now what they have to learn how to do is how to utilize the healthcare system in the absolute most efficient way, not wait till the last minute, but more importantly, utilize it when they need it in primary care, preventative care, and get in there and control chronic disease.
I must ask you about the Latino community in California. We had been speaking since October about how low the numbers were in terms of Latino Californians signing up. Boy, what a difference a few months make. By the time the deadline rolled around in late March, Latinos started to enroll in significant numbers, still a bit below population levels, but much better than it had been.
Right.
What went right?
Well, what went right is Cover California readjusted. They understood that their message was not on point. They were able to bring in individuals. They did marketing, more targeted marketing. They worked in collaboration with the legislature, the Latino caucus.
Right.
We made sure we outreached in the specific communities that had the highest incidence of Latinos, did fairs, we did, you know, Cover California meetings and collaboration. We did all the signups together to get the message out, and the population increased significantly. And what you're going to see is we need to get ready for the next enrollment period to make sure that it continues to move forward.
When we come back, sir, I want to speak with you about the Medicaid expansion. Okay. Some surprises with regard to the expansion. For our viewers on HLN, we thank you so much for joining us. For our other viewers, we'll be right back with Senator Ed Hernandez. Sir, I want to speak with you about the Medicaid expansion. As we know, part of the big selling point was that the federal government would cover the cost of new enrollees in Medicaid if the states accepted the expansion. But that's not the whole story, really. Could you explain?
Yeah, that's partly true.
Right.
Keep in mind that Medicaid or Medi-Cal in California has always been covered 50-50 up to 100% of the poverty level.
Right.
The Medicaid expansion is from 100 to 138% of poverty level, so all of those new enrollees will be covered 100% by the federal government. we are still going to be paying 50% of everyone else.
And what happened was, because there was so much advertising and push to get people to sign up through Covered California, you had folks under the 100% level that it's not covered 100%, as you said, and those numbers are well over 1 million folks.
Right. So what happened is, we always knew that there was individuals out there in this state that were eligible for Medi-Cal, where we paid 50% but never enrolled.
Right.
So we did such a good job educating the consumers.
Sure.
They got on the phone, they signed up, and oh, by the way, you're eligible for Medi-Cal, but it's the part we have to cover.
Were you aware of that distinction?
Yes.
You knew that was coming.
It's always been there, because the Medicaid expansion was very clear from above 100% of poverty level. It was in statute,
Sure.
it was in the legislation.
But did you expect that California would have to adjust its budget, for example, at the May revise, because over 1 million people signed up, causing a budget hit of over $1 billion?
We knew there was individuals out there. We knew it was a large number.
Right.
But these numbers just blew away our expectations.
It's a blessing.
It's a good thing, because that means more people are covered. So, but I also think that this initial money we're going to have to pay out is going to level out, because I don't think there's that many more individuals out there that are going to come into the system. So this is something that's going to be ongoing from this point on.
We know that other states have not signed up for the Medicaid expansion. It's about half-half at this point. I'm wondering if news like we just described could cause a disincentive for these other states. That California all of a sudden didn't realize, I mean, they knew all along, but it was such a great expansion that they have a hit to their budget.
It could be, but keep in mind that because of the Supreme ruling, that states could opt out of it. So I think the states that did are the ones who obviously don't want the Affordable Care Act to be successful. But if you take Louisiana, for example, if they did the Medicaid expansion, which is covered by the federal government, it's close to 70 to 80% of their population is going to be covered. That's a lot of money left on the table by that state. And that's exactly why Kentucky did it. It's a Republican state. The governor said, this is money that's going to help reduce costs for health care, more money coming into the state, more doctors are going to get paid, but more important, his constituents will be covered and they'll have a healthier state.
I want to ask you about Kentucky and use it as an example for what we're seeing with regard to the Affordable Care Act. I read a poll recently. Kentuckians were asked, do you support the Affordable Care Act? No.
Right.
Do you support Kentucky Care? Yes. It's the same thing.
That's the same thing, yes.
What is it about the optics of this, that in a state that the Affordable Care Act is so successful, just changing the name?
Well, what it is anything to do with health care since its inception from the Johnson administration, it's always been controversial, and it's always been politicized. So they politicized Obamacare, but in Kentucky, it's Affordable Care Act, Obamacare. The Republicans were opposed to it, but yet they passed it in Massachusetts, which was Romney's blueprint. That's what we have.
We also see in the polling that senior citizens tend to have more negative views of the Affordable Care Act. Yet if you ask them, do you support Medicare? They will say yes. Medicare is a government program, but they're opposed to the Affordable Care Act because it's a government program. Same problem?
Same problem. And I think it's just the messaging, what's in the media, what the public's perception is. And I would think that they're opposed to it because they already have a service. But it's a public program.
At the same time, the numbers are turning on the Affordable Care Act, and they're turning to the advantage of the Democrats and the president. Do you think they turn strongly enough so that November is not as much of a difficult election for the Democrats as some think it could be?
I don't know if it'll turn in time. My goal is that it turns enough that we maintain the Affordable Care Act forever. But I'll give you an example. When Medicare was signed into law during the Johnson administration, it was the American Medical Association and their House of Delegates voted to not accept Medicare because they didn't want socialized medicine.
Oh my. His name is Ed Hernandez, member of the California State Senate. I'm Brad Pomerance. It's California Edition.